And then I will say that what you all been waiting for is like the FBI to come in and arrest us at any moment. Really, I just wanted to communicate a couple of things. We're going to talk about hackers. We're going to talk about malicious hackers. I want to just say that hackers generally are your friends. I'm going to say there are many hackers in this room, you don't even know you're a hacker yet. We grew up in the hacker space. Back when it was just, we didn't even know our names, like that we were hackers. This is the key. Hackers generally share a curiosity. That's what drives them, thinking about how to solve problems in creative ways. And they just happen to apply that problem solving to digital systems most of the time. And when you think about that, that's a skill set all of you have, creative problem solving. So I just want to say, hackers are not your enemy. Malicious hackers are. Those that wish to use that knowledge to circumvent systems in a way to exploit them, to make money, to extort hospitals. They are hackers, but they're more so just bad people. So please don't conflate the two. This is my plea for you today. All right, I'll be quick through this one. Takeaway 1. Data privacy is still the predominant paradigm in healthcare cybersecurity. Still is. What does this mean? It means you all are, as Jeff mentioned, used to having emails talking about your passwords, protecting them, talking about phishing attacks. Make sure you don't fall victim to someone trying to trick you on your email. Maybe you're familiar with physical security, where you'll make sure that people don't come into your unit without a badge to identify. We do the same old recycled enterprise security training that is also in finance, that's in many other verticals. This is what healthcare's predominant focus is. And why do we do these things? And why does everyone think that this is the entirety of healthcare cybersecurity? It's because we all fear the HIPAA hammer, right? Like, I feel like it should be like Voldemort when I say HIPAA. It's like we're all scared that we're going to have a big breach, right? And it's going to turn into some lawsuit. We also care deeply about our patients' privacy. Don't get us wrong. But this is what people think is the entirety of healthcare cybersecurity. We will spend the next 50 or so minutes trying to convince you that it's far more about patient safety than it is about this. So we're going to talk about HIPAA. Just kidding. We're going to talk about something else. I know some of you out there might be sad about that, but. And I'll also say, unfortunately, it's a battle we've lost time and time and time again, despite pumping millions of dollars into it, despite requiring all of us to do all of that training, we still fail all the time to protect patient data. So I don't want to say let's not worry about it because it's like a lost battle. We still should focus on it. But let's just be clear that if this is the metric of our success in healthcare cybersecurity, we're getting worse and worse every single year.
So the next takeaway is obvious, I think, but it's one that we can very easily forget because it has become so enmeshed in what we do on a daily basis. This next slide here is a painting that Christian and I saw in one of the first lectures that we had at medical school, and it has resonated with us very deeply ever since. And it really just kind of depicts, I think, the ideal version of the clinician-patient interaction, right? You have somebody at the bedside watching over and caring for a patient. And this is something that obviously, as nurses, you do more than any other team member, right? You're there caring, treating, nurturing directly at the bedside. But the reality is the bedside of today looks very, very different than that painting, right? And we have the ability to use an incredible array of technology, often connected to the internet, to help care for our patients, whether they are automated drug pumps that are able to update their reference doses with online downloads, fancy ventilators, heart-lung machines or dialysis machines. The things that we take for granted have become so dependent on what we do that sometimes it's very easy to forget that we have to think about them as machines in a certain context. And so what we do often when we're speaking with non-clinical audiences is do a case presentation. And I think this kind of highlights what we're talking about here. So most of us know here, we have a patient, 68-year-old female. She's got high blood pressure. She's on some medication for diabetes, and she had AFib, so she's got a pacemaker placed for that. And her husband finds her with acute weakness of the face, left arm and leg, right? So you don't have to be a nurse or a doctor to be concerned about the possibility of a stroke there. But we know that there's a very time-sensitive window that we can provide an intervention to this patient to achieve the best possible outcome to hopefully prevent morbidity or mortality. So as soon as this pathologic process starts, the clock is ticking, right? And in certain cases, as you know, if this is a blockage of an artery that's resulting in that cerebral ischemia, then there's a medication that we can give that can help to relieve that blockage and restore blood flow. That same medication, if she's having a hemorrhagic bleed, could kill her. So very important to be able to distinguish this. And how do we distinguish this? Obviously, we're going to get some type of neuroimaging, usually a CAT scan. And again, all of this takes place within a very predefined window, and there are guidelines by specialty societies that tell us, you need to start to aim for these metrics, right, within a CT scanner by a certain time. Have that read by a radiologist within a certain time. Get that TPA in that patient within that certain window.
So we're going to walk through the clinical workflow that you all live every day for the point of highlighting each individual point of failure with a cyber attack. And that if at any point in this patient's journey, there should be a failure of one of these points, she will not get her TPA in time. That might be the difference between whether or not she walks out of the hospital, whether or not she walks at all, whether or not she goes to a skilled nursing facility or some type of long-term care because she can no longer feed herself. So of course, starting off at home and calling 911, something we all take for granted. You can pull out your phone, dial a number, and within hopefully 5 to 10 minutes, you'll have some trained healthcare professionals at your door taking care of you. Some of our earliest research was looking at the cybersecurity vulnerabilities of the 911 system, specifically the PSAPs, which is where the dispatchers take a lot of the calls. And we found pretty significant vulnerabilities in that infrastructure. And with relatively little knowledge and not that much money, you could easily attack an entire region's 911 system. So that if you were to pick up the phone and call 911, you'd get a busy signal or you'd be diverted to another county. We don't really think about these things, but if it should fail even at that point, they're not going to get an ambulance to Ann Nelson early enough. She's not going to make it to the hospital in time to get her TPA. Let's talk about the hospital flow, which is this middle section here. I showed you a slide that healthcare breaches are up. We can't usually go a week or two in this country without seeing some news about a ransomware attack on a hospital. Generally speaking, the infrastructure of hospitals and their ability to protect against cyber attacks is, I think, categorically poor. And it's hard. We have so many competing interests. We have so many things that we have to spend money on. But one of the things that's really hard is how do you take a hospital with thousands of employees, thousands of computers, a big footprint, and try to secure that against a hacker who only needs one way in? It's a hard thing to do. Jeff mentioned the CT scanner. We know that's the critical diagnostic step in this patient's care right now. It's just a computer. It's a computer with a fancy imaging attachment to it, but it runs an operating system just like the one in your laptop. It connects to the internet just like your phone. But the difference, I would say, in most of the CT scanners is that they don't get the same attention to security updates as your own phone. Isn't that wild? That your phone is probably more secure and has more regular security updates than that CT scanner, and that CT scanner supports life every day. Generally speaking, medical devices are on a trajectory to be more secure, and we'll talk more about that. But at the end of the day, just think about these things as just computers, the same as your home that can get infected with malware and spyware and fall victim to attacks just like any other computer. And then lastly, on the bottom, the clinical workflow is so key to this. I've talked time and time again about how the electronic health record is the operating system of healthcare. You cannot do anything effectively in taking care of patients nowadays without interacting with the electronic health record, right? We can't room patients. We can't see results. We can't administer medications quickly and timely. We can't do all these things. Everything is integrated into the electronic health record. And when that is no longer functioning, everything grinds to a halt. And doctors like me, nurses that have never used paper charts, like, what do we do? Let's go on TikTok and find out.